Hi, my name is Katie Russell. I am one of the pediatric nurse practitioners here at Northeast Pediatrics, and I wanted to talk to you today about asthma. We're going to do a brief overview of asthma education. Asthma is a chronic condition that involves the airways, the large airways and the small airways in the lungs. I have a great model here that I usually use a lot to help my parents and patients understand. So this is a normal airway, and you can see it's nice and open and round, and air easily flows in and out. This is what an airway looks like that is having an asthma exacerbation. So there's two components to this airway. Inflammation, which is on the outer part of the airway, and then constriction, which is in the inner part. And you can see that when the airway constricts, that it's much smaller, so it's the same amount of air trying to get through a much smaller hole. And then you also have mucus in there, which is why a lot of times when your child is coughing, you'll hear that kind of mucusy, like a productive cough, and that's what's causing that that productive cough is that mucus that's sitting way down in the airways. I like to tell my parents that it's a lot like if you got a straw at home and you pretended if you breathe through the straw for a minute or so, that's the same way that your child feels when they're having an asthma attack. So same amount of air, but trying to go through a much smaller airway. And that's what also causes the wheezing sound that you'll hear a lot of times, that whenever your child breathes out, that's the wheezing sound that you'll hear. And that's completely from that same amount of air trying to go through a much smaller airway. So we're going to talk a little bit later about constriction and inflammation, and we'll talk about what medications treat each one of those symptoms. Triggers are anything that causes your child or whoever has asthma to have an exacerbation. There's a wide range of triggers. Allergies are a very common trigger, so think about dust mites, mold. Other things that are non-allergens that are triggers are smoke. Sometimes just cold weather or cold air can do it, dry air. And then also there's dust, just from a regular, sandstorm, dust storm, anything like that can cause your child to have an asthma exacerbation. It's extremely important to know what your child's triggers are, because that is normally the very beginning part of asthma. And so if you can catch them, if they can avoid triggers, or you can catch them before those triggers really kick into play, then a lot of times we can control the asthma. Research indicates that actually up to almost 80% of asthma in children is allergic asthma, which means that it is caused by allergies or triggered by allergies. So it's very important to know what those triggers are. A lot of times your child will be put on an inhaler, and this is just a sample of an inhaler. There's two kinds of medication that we use for asthma. So there are rescue medications, which some examples of that may be albuterol or Xopenex. It can be in an inhaler form like this, or it can be in the nebulizer. And then there are controller medications, which actually contain a very low dose of an inhaled corticosteroid. And what that does, it works on that inflammation part that we talked about, the outer part of the airway that's inflamed, and that works on decreasing the swelling in that outer part of the airway. So some examples of some controller medications may be Qvar, Flovent, Advair, Symbicort. All of those are controller medications. It's very important to understand the difference between the controller and the rescue medication. Most of the controller medications take days to weeks to actually work. So you want to make sure that when your child's actually having an asthma attack or an asthma exacerbation, that you're giving them the rescue medicine. That's the fast-acting medicine, like your albuterol or your Xopenex. It's very, very important to have an asthma action plan that outlines all of that for you. It should tell you your controller medication at the top, which is your daily use medications. There may not be any controller medications depending on what type of asthma your child has. If they have a mild form of asthma, then your child may just need rescue medications. But if it is a more in-depth form of asthma, your child may need those controller medications. And that would be listed at the top of your asthma action plan, and then underneath that is your rescue medication. So it's very important to have a good understanding of the different medications and how they're used. I'm going to go over very quickly how to use an inhaler. with a spacer. You also might have heard it called an aero chamber or an inspira chamber. Very important to understand how to use this and to use it correctly. So what you're going to do first, if your inhaler is an HFA inhaler, and you can look on here and it will say that HFA, that just means that the medication is propelled in the inhaler. So what you're going to do is you're going to shake it up really well. There's a hole you can see in this side of the aero chamber. So you're going to put your inhaler right there in that hole, and then you're going to cover this, your child's mouth and nose, with this spacer. So just like this. You want to make sure there's a good seal, a C curve. It's very important that this face mask fits your child properly. So you want to make sure that it's just above the nose and just at the base of the chin. You may sometimes see some of these aero chambers that do not have a mask. They just have a mouthpiece. And that's what we use in older kids because they can put their mouth on there and create a very good seal. So what you're going to do, you're going to put it up to your child's face. You're going to do 1 puff into the tube, and then you're going to allow them to take 5 slow breaths. Now, I realize that there's some younger children that may not be able to take those 5 big breaths, and that's okay because the medicine is still going to get to them. This is what the aero chamber is for, is it allows the medicine to be spaced out so that they can breathe it in. It is extremely important when you're using an HFA inhaler to always use a spacer. It's even recommended for adults to use a spacer. The reason for that is that if you do not use a spacer, you use the inhaler right at the mouth, most of the medicine actually sits on the back of your throat. So the spacer is what allows you to actually breathe the medicine down into your lungs where it's going to be most effective. Now, there are other types of inhalers and asthma medications that are more discus. So Advair is one. Albuterol also comes in a inhaled powder form now. Those medications you do not need a spacer with because you're just going to breathe those right in. So it's very important to understand which medication you have and what you need to use it with.